Zygomatic dental implants. What are those? What are they for and how long are they?
They're about 50 to 55 millimeters. They can start anywhere from 35 and go up to 55. From the jawbone to the zygomatic bone. Underneath the eyeball, right into that zygomatic arch.
Okay, so that's why they're called zygomatic dental implants, because they go into the zygoma. That's the bone, right?
Yes.
Why would a patient need that? In what cases?
These are the implants that we place when people don't have enough bone. If you have severe bone loss, we have sinuses on the top, right? Over the time, if you're missing teeth, those sinuses can drop down or they can move forward, which eliminates the bone for us to place implants. So that's the reason if we don't have enough bone on the top, we'll go for zygomatic arches.
So you are saying that you can still help someone that's been missing teeth for over a decade and now have significant bone loss because you can provide something called zygomatic dental implants.
Yes, we can still help.
Let me ask you this. A person that's missing so much bone, can they still wear dentures?
They can still wear dentures very hard. They're struggling because you don't have enough bone, right? You have a flabby tissue. If you don't have enough bone, sometimes they have a lot of tissue. And then they use a lot of glue to stick that onto their tissue. And that prevents them from eating and talking. Some people don't even wear dentures.
If someone is watching right now and they've been rejected by other dentists due to bone loss, how can you help? What is the process?
Okay, well, first thing we do is we take a 3D imaging, right? So we can see their zygomatic arches. Then we have a model with the zygomatic arch that we show them that, hey, you know, you don't have any bone here. This is the bone that we will be using. And these are long implants. The first reaction, they do get scared because they're long implants, right? So we show them the implants. We show them where it's going to be placed. We get them comfortable because we're teamed up with anesthesiologists that puts them to sleep so they're not aware of what's happening. Completely painless.
It requires a special skill, does it not?
It does. We're working close to, proximities that are very important in the face. You got the nerve below the eye here. You got the eye muscles here, right? Then you have other, anatomical structures that you want to avoid.
So you just opened a new location. Where can patients see you?
Yes. Now we're open in Roseville, California. The good news is we have lots of experience in placing zygomatic implants. I've seen a lot of patients that are being rejected by other dentists who does not have this certain skill of placing zygomatic implants. Good news is we have lots of experience and good results with placing zygomatic implants. You don't have to go anywhere. We're in your city. Come see us.